Just about when it seemed that the 40-year-old war would end and Afghanistan may witness some sort of political settlement, the COVID-19 outbreak has taken the country by surprise. The outbreak poses a huge challenge to the already crumbling health infrastructure of the country. Our next report explores more.
The pandemic has already claimed 30 lives in the country, but the severity of the challenge has not dawned upon the administration. Afghanistan is not prepared for the pandemic.
We are not yet sure if we are able to tackle this. As a developing country or underdeveloped and a war-torn country, we have a very bad health service, and I'm not sure if we are able to have thousands and thousands of COVID-19 virus patients taken in hospitals and quarantine centers.
Kabul's problem is twofold. First, the people did not take the lockdown seriously, and then the state could not enforce it, not even in an urban center like the Afghan capital. The result was this. The lockdown was a miserable failure in Kabul. In desperation, the state ended up deploying more forces to enforce the measures.
Right after the initial 3 weeks quarantine of Kabul city did not work well for the government and the police, the Afghan Interior Ministry deployed an extra 1,600 police officers with 400 vehicles in order to enforce the shutdown and quarantine for prevention of outbreak of coronavirus in Kabul, Afghanistan. But this has seemed to leave Kabul's middle class and lower class laborers with plenty of problems.
They have failed to handle the coronavirus pandemic so far, and they cannot handle it in the future. It would be better to slaughter all people in the country and end it for once and for all.
We walk to work in the morning and walk back home in the evening. There is no income. The situation is so bad that we barely earn something to eat.
The moves may have come too late, and Afghanistan doesn't have what it takes to cope with such a crisis. The health infrastructure is dilapidated. Years of war have left the systems in a very bad shape. The shutdown is hurting the economy. High inflation is further eating into the salaries of the middle-class citizens.
Just as prices for the sanitization goods go up in Kabul city amid coronavirus outbreak and shortage of these material, a box of hand gloves that used to be for $2 or $3 before now has reached nearly $20, and a pack of face masks is at $18 here in Kabul, as they are short on the pharmacies market and are sold here on street sides.
Afghanistan is trying to build capacity at home. The government inaugurated an N95 and PPE suit factory in Kabul recently with great fanfare. Authorities say the masks will be produced locally but will meet international standards. It's a welcome step, but not nearly enough. This is like a drop in the ocean. Afghanistan needs 1 million masks to equip medical workers. This is going to be another very difficult battle. With Mustafa Kazemi in Kabul, Bureau Report, WION World is One.